Now, ladies and gentlemen, from this, once again, we will shift our focus from individual leadership to a more holistic approach. And at this juncture, we are getting into a keynote which actually explores how capital infusion, infrastructure expansion, and the new care delivery models are truly redefining healthcare access, and especially in the context of tier 2 and tier 3 cities. Earlier during the panel discussion, this was a point which was fairly touched upon, which was speaking about the fact of healthcare availability and accessibility in the tier 2 and tier 3. So from this perspective, this next keynote becomes even more important and relevant. So to give in this keynote, let me please invite Dr. Girdhar Gyani, who's the Director General, Association of Healthcare Providers India, AHPI, to please step up on the stage and share his views and opinions about the same. You can do a better round of applause, please, would you, ladies and gentlemen. It's a pleasure to have you here, sir. Thank you, sir. Thank you.
Okay, good afternoon. So this topic, actually what has been given to me, where is the future going in the healthcare, how we are expanding our infrastructure, and what is happening precisely in the government. Now, to begin with, I will say the first major positive which has happened in past 1 week is that we have regained our full-time health minister. So that is the most important thing has happened, let me tell you. Because past 1 year, we have been more or less struggling to meet with him. We hardly get any time to meet with him, and that too, very unfocused discussion happens whenever we meet with him. But now I think things will change. So that is one. Second most positive thing which is happening in the government is now that we have now full-time member in the Niti Aayog. Other than the health, Dr. Vinod Paul is already there. But there is now one member appointed only for the purpose of doing ease of business. And his focus now is the healthcare. So that is the second positive which has happened of late. Now, otherwise, whenever because I keep meeting with the government very frequently, the focus now is bringing back. You see, let me tell you, many people say that why government is not able to increase the GDP investment more than 2%. Let me tell you, the inside story is that government is focused on making India a developed country by 2047. Now, for that purpose, the first priority becomes the infrastructure. Because only infrastructure will make you, inching towards the developed country. That is the one. Second investment which is going in the defense. Because somehow the government priority now is that unless we are self-sufficient in the defense, most of our money was going into import of the defense equipment. So a lot of effort and money is going into not only buying equipment, but buying technology. So that is the second area of investment. Third investment is in the agriculture, because that is our political priority as well as the necessity of the nation. So that is where, we may talk the healthcare is important, but in terms of investment, the priority of healthcare comes at number 5 or number 6. So that is where we are. But at the same time, now government has started thinking of really bringing universal health coverage in true sense. Now, why I am saying in true sense? Because one of the report which we have submitted to the government of India, now they are working on it. This report was, number one, what is the health infrastructure? So we found that there are around 2.2 million beds. And out of which, actually we need 4 million beds. So that means that is going to be a push in that direction. How that push will happen, I will cover a little later. So that is from 2.2 million to 4 million beds we have to go. Second most worrying point for the government was the disparity from state to state. Now this was never noticed by the government. The disparity is that Bihar is the state in the lowest place, having 0.3 beds per 1,000 population. Mind you, this figure I am quoting, 0.3 beds per 1,000 population, while Karnataka is having 4.2 beds per 1,000 population. So that is the kind of variation which India is having. So now I think the government is trying to, because ultimately health is the state subject, but even, let us say, government of Bihar was not aware about it, that this is where they are. Now, for example, Delhi is very well placed, more than 3 beds per 1,000 population, but still you never get the bed. Why? Because the people from Madhya Pradesh, from Haryana, from Uttar Pradesh, and from Bihar, they all rush to Delhi. So that is where, you never get the bed. So that now is going to be the serious push from central government to these states, giving the respective data that you have 1.4 bed, you have got 2 beds, or things like that, So that is the second priority. Third is on the accessibility. Now, accessibility, the government has noticed. For example, the data, let me tell you 2 data I will quote. For example, Telangana has got around 126 what we call tertiary care hospitals, 126, out of which 118 are in Hyderabad. So again a serious problem. That means for rest of the Telangana, virtually has no tertiary care. Everybody has to come to Hyderabad or Secunderabad. So these are the issues now where the government is seriously working on it. In terms of doctors, the WHO will tell you that we have got 1.3 million doctors, which is good enough, 1 doctor per 1,000 population. But sorry, out of this 1.3 million, only around 60% doctors are having the PG qualification. So that means practically we have only that many doctors available to take care of the patient, because MBBS today, I don't know, I'm very sorry to say, we don't really consider them as the doctor. They are doing all junior residential job. Anyway, so this is where again the number of PG seats have to be increased, and the latest is that we might push into the parliament the bill to bring a exclusive PGI kind of institution in the country. That means exclusive PG institute, so that all these undergraduate seats which we are increasing now, 110,000, can get into the admission at fast track rate. So this is what actually is the third priority, what is happening. One more investment which recently, now in the budget you will find, it will happen now, is the budget for indigenization of the medical equipment and medical devices. So that area, government is now convinced that like in defense we were investing too much money on import, similarly that much money is going into import of the medical devices and medical equipment, particularly radiology, I will say, and even the diagnostic. So that push is going to come very soon, and already I think that 4 hardware parks have been set up in the medical devices. So you will find the productionizing happening in that sense, because government now, the latest thinking with the government is not only to make the requirement for our own country, but also export. Similar, the way defense is being exported. So I think that way government is very clear to improve the economy or come into the segment of top 3 economy, we have to focus on few these areas which actually is going to happen. So that is about the healthcare infrastructure. Fourth thing which I would like to mention is on the diagnostic side. I think in the panel you find that genomics is happening, personalized care is coming up. Now these areas ICMR actually is going to push little more effort now and involve the private healthcare sector in the country so that we focus on that area. So that is the fourth area which government now is focusing. One more area which I would like to focus, because the way I am looking at the government thinking, is the National Health Authority. I think their push on digitization, unfortunately, has gone very, very slow. Actually, that is, I think they have got now full-time CEO. Unfortunately, such an important organization did not have the full-time CEO after R.S. Sharma left. But now I think they have got the full-time CEO. So we will be seeing that National Digital Health Mission will go into the fast track. And you will really find that all digitization, they are taking help of the ISRO, so that we will have the, digitization of the healthcare, pharmacy. You think like any healthcare establishment will be done through the ISRO, and we will have the directory of these things. Plus, Aadhaar number, which also has gone little slow, again will be pick up, and we would like to give 100% population will be covered up for the Aadhaar number. And finally, the last thing which government is worried at the highest level I am quoting now is that unfortunately the Ayushman Bharat on paper looks very good, that 40% population is covered. States like Telangana and Andhra rather are covering 90% of the population, but on practical side, these beneficiaries are actually not getting the benefit by the private sector. Why I am saying private sector? For the 86% as per the statistics released by them, 86% of the tertiary care beds are in the private sector. And unless the private sector takes the patient of the Ayushman Bharat, this scheme will not actually really materialize. And that is at the highest level, again I am saying, is the biggest worry. So now what the thinking is going on is, because states like Telangana and Andhra, and even to some extent the Tamil Nadu, and now recently Rajasthan is saying that we will cover 100% population under the Ayushman Bharat. But central government is determined to give only 60% money for the beneficiary initially defined, that is 40%. So that means rest of the money has to come from the state government, which unfortunately even state do not have the money. So I think this is where now government is thinking that can we go into the insurance model? So that I think process is on now, because otherwise, and third one is that government is also thinking of introducing co-payment. Co-payment in the CGHS to begin with, so that some of the major hospitals take the CGHS patient, and the difference between what is being given by government and what is the market rate of the hospital will be paid directly by the beneficiary. And most of central government beneficiary, as I contact with them in their association, they are prepared for this particular model. So that is another thing which is happening. So all in all, I will say, we are moving into very positive direction. There is a huge potential in the healthcare. Simple factor you could say, now from 2.2 million to 4 million beds if you have to go. And, oh sorry, last thing I forgot, because you mentioned about tier 3 towns. Now from the Prime Minister's office, the requirement is immediately to have 3,000 new hospitals with 100 bed and above in the tier 3 towns, for which the incentives are being worked out. And these incentives will be like single window clearance, giving loan at 6.5%, giving subsidy on the electricity, and helping them in acquiring the land. So these are the 4 areas which government is working now, because unless you have got tertiary care hospital in tier 3 town, I think Ayushman Bharat, or for that matter, healthcare delivery in our country will not actually work. So I think these are the things I will tell you that government really is now getting focus. And 2 things which I told you, health minister joining full time, and the member in the Niti Aayog which is working on how do we make the business easy in the healthcare. You will see the results, I think, very soon, because this particular member was highest serving cabinet secretary for 5 years. So you can understand his background, and that is where from he is coming. So I think these are some of things I thought I will share with you. And we should have all very positive frame of mind that we are in the business of healthcare, and which is going to really show us, well, ultimately let me tell you, we will not be developed nation unless we are also developed in the healthcare. So I think with that, thank you very much. I know we are having very shortage of time. Thank you very much.
Yes, sir. Please, I'll request you to stay with me while I invite Dr. Naveen to please once again step up onto the stage and present a small token of our appreciation and our gratitude, sir, for sharing your insights and your thoughts with us. Thank you so much.